Hey guys, I had a question this week about training a brand new CA. And I can tell you that having a new CA can be a very daunting experience. You know, they don't necessarily know what to say, they don't know when to say it, they might say the wrong thing. And in general, they might not have the best understanding about how the practice runs. And I can tell you, having trained some stellar CAs over the years, there's one thing that I've done that has remained very consistent, and I think you got to try this. Okay, so before you kind of sick your other CAs on them, or maybe you don't have that, the very first day, you got to sit down with them and give them a what I would call a bird's eye view of a standard chiropractic patient or an ideal chiropractic patient process. So you write down day 1 to 365 on a whiteboard. So day 1 is new patient. And so you help them understand. They come in as a new patient, they go to a report, they have 20 adjustments, they have their first progress exam, they have 20 more adjustments, they have their second progress exam, or whatever it is in your office. They get to the third progress exam, then they get to the fourth one at the end of their first year, then they go to a wellness report, and then they enter into a yearly where they have a progress exam at 6 months and another one at a year. So the first thing is just to give them a general understanding of sequentially how a patient goes through your process. Then second, to help them understand that process, you divide each of those into what my duty would be or what your duty would be. So as an example, so the new patient, well, when they call in, what you would need to do is this. Answer the phone, use this piece of paper and ask these questions. You have a piece of paper sitting beside the phone that says, who can we thank for referring you? Is this appointment for you or your whole family? All the different questions that you would ask a typical new patient. And then you talk about the new patient exam. It's your job to schedule the appropriate time. So here's the appropriate times for new patients. And go through it in a logical, sequential order. When they understand it that way, it becomes logical to them. The faster that your procedures are logical to your CA, the faster she can act authentically and be quick on her feet. Only after 3 months are you really getting into the fine tuning of things. You want to make sure she has the basics down. So at the beginning, on day 1, you'll spend 2 to 3 hours going through day 1 to 365. And you're not training on every single thing, how to answer the phone, how to do this, how to do that, how to send the emails. You're not training on all that. You just give her a general understanding of all of those things. Then, when you break them down, you'll break them down into things that you consider the most important. So as an example, she should be able to navigate your office software to be able to make an appointment. She needs to be able to, if she picks up the phone and somebody wants to change an appointment, how can she change an appointment? And of course, very important, how to take, receive, and enter a payment. Those are kind of the basic things that if she had those, she can get by. That would be what I would start with. Then you can break each procedure down over time as it goes along and get further details into it. But the first thing is to not overwhelm them with all the details. It's to give them a general understanding of how the whole system works. And perhaps you have a CA that's been with you for a while that needs that as a review. Maybe your team needs that as a review. The next thing I would do is get the CA to read a copy of Chiropractic First. Chiropractic First is a great book written by Terry Ronberg. It's designed for the chiropractic patient, the layperson. And I would say to them, I'd give it to her, and this is what I've done with over the last 12 or how many ever years. I give them the book, and I say, I want you to be able to answer a couple questions. Number 1, I want you to be able to explain to me what a subluxation is. Number 2, I want you to be able to explain what a subluxation does to the body left uncorrected. Number 3, I want you to have a general understanding of the nerves. So I want to know, what are the nerves coming out of the neck control, coming out of the mid-back control, coming out of the low back control. I want her to have those main principles down so that she's able to at least be a little bit more educated than the patient. And I want her to have that as a background of knowledge. I'll give them a lot more as time goes on. I want them to be black belt trained, but before they can be black belt trained, the foundation has to be perfect. So if you're training a new CA coming up soon, those are the main things I want you to focus on. focus on giving them a day 1 to 365, then break it down into her responsibility for each of those components, help her navigate the office software, and give her a copy of, or him a copy of, Chiropractic First. That'll get them started on the right foot. All right, guys, have an awesome week.